last talk, but most important, I would say, overview and legal issues will be taken by Dr. Purendra Bhasin.
Thank you, Dr. Bharti, and I am really happy to be included in the instruction course. Overview and legal issues. I think this is one of the most important aspect of understanding of the post-LASIK ectasia. As we all have understood by now that it's a known risk factor. And in this there occurs a progressive steepening and thinning of the cornea after corneal refractive surgery. The most important thing is that it can occur following, it's not coming over here. No, it is full screen here. It can occur following LASIK, surface ablation, PRK, smile, radial keratotomy, or astigmatic keratotomy. Any corneal refractive procedure can lead to yeah. Thank you. So, corneal refractive surgeries, as we have understood by now, it disrupts and thereby alter the structural integrity of the cornea. LASIK reduces the corneal structural integrity both by reducing the overall available load-bearing tissue and by shifting the load-bearing responsibility to the structurally weaker posterior corneal stroma. As Dr. Bharti has said, that it was first reported in 1998 by Theo Seiler, and it occurs in majority of cases within 1 year of surgery, but in literature says that it can occur. There are 9 cases reported in this study wherein they have occurred 6 to 11 years after the LASIK surgery. So this is also very significant, and that the corneal strength is significantly greater. As we all know, the corneal strength is significantly greater in the anterior 40% of the corneal stroma than in the posterior 60%. And we are the load bearing or the stress is now left on the posterior weak the cornea which is available to us. When the complication arises, it does not necessarily mean that the patient was a poor candidate for the surgery, that the surgery was contraindicated, or that there has been a violation of the standard of care. Patient only says that something has been missed preoperatively, and this is the result of abnormal corneal morphology or thickness that has been overlooked prior to the surgery. Various risk factors has been enumerated. The other risk factors which have not been mentioned over by the previous speaker is the aggressive eye rubbing or other sources of blunt corneal trauma, and sometimes in pregnancy or various antidepressants when the patient take, they can also lead to the risk. There is an increased risk of keratoconus in these patients. Most reported cases of ectasia after LASIK had at least one of the risk factors. Nevertheless, there have been case report of ectasia developing in patients even without risk factors after LASIK and surface ablation. Ectasia can also occur after uncomplicated surgery, even though candidates are appropriately screened. So it's a mystery, and various things have been suggested by now that has been dealt with by the previous speaker. Incidence earlier was 1 in 2,500. Because of the better diagnostic screening technologies, it is now roughly 1 in 4 to 5,000 cases. LASIK surgery, now that the important thing which comes in the mind of all the refractive surgeon is that what is the cutoff and why we should take it seriously, the risk of ectasia. Because all the lawsuits in the America, 30% of all ophthalmology malpractice claims are following the LASIK surgery. A prominent New Jersey laser eye surgery has agreed to settle a medical malpractice suit of $2 million after performing a corrective vision procedure on a man who should have been ruled out to have a pre-existing eye condition. Another patient had steep corneas, and that's how the patient developed corneal ectasia later on. In 2011, there was a lawsuit of $45 million in by Dr. Kevin, which has to be paid by Kevin Nixarly, and the evidence showed that Mr. Devdas developed a visually disabling condition post Lasik ectasia. So this is the thing why it is important for all of us to understand this. And in 2011, another lawsuit was for the negligent performance of LASIK surgery. When the patient had undergone 4 repeat LASIK surgery by the same doctor, he went for a second opinion, whereupon he learned that he had the corneal disease known as ectasia. Dr. Duplessis was found to be negligent, and he has to pay the lawsuit has to be was against him. The liabilities of doctor arising under statistics in India are that the patient can go to Consumer Protection Act, patient can file a civil suit, patient can apply Indian Penal Code in criminal code, or report to the Medical Council of India. So all these things can occur, and your practice can be affected, or your practice can be banned. So that's why it is so important. In India, several cases has been reported against ophthalmologists, and decisions have been taken by National Consumer Disputes Redressal Commission. Out of 942 cases of medical negligence were decided by NCDRC from 2002 to 2018, and 30 were related to ophthalmology. A total of 73.3% of the alleged case of medical negligence in ophthalmology were proved, and compensation for the cases range between 2 lakhs to 10 million in India. So this is now increasing, the remuneration part is increasing. So this is the informed consent which is now available with all of us. This has been circulated by All India Ophthalmic Society, which has got all the details, and patient should be given to read this, and after that a consent should be taken by the patient and the attendant both. To conclude, if you know the enemy and you know yourself, you need not fear the results of 100 battles. If you know the enemy, what can be the outcome, if ectasia can occur or not. If you know yourself but not the enemy, for every victory gained, you will also suffer a defeat. And if you know neither the enemy nor yourself, you will succumb in every battle. This is The Art of War by Sun Tzu. To conclude, a thorough pre-operative workup should be done. Strictly follow the guidelines. Don't do the cases in a haste. Explain all pros and cons to the patient and the attendants. If in doubt, better to wait. Or do not go for corneal refractive surgery. You can suggest for lens-based or phakic IOL surgery, and best thing is to ask the patient to wait and see the progression and ectasia, if it is there, early signs of ectasia are there. And do not hesitate to take opinion from your experienced colleagues. Thank you for your patient hearing.
Thank you, Dr. Bhasin, and I will now invite questions from the audience. If there are any questions, we can explain whatever questions